Hi, it's Beck here from Sunbury Local Businesses, and I'm here with Andrew and Christine from Vineyard Medical Centre. How are you guys?
Good, thanks.
Thank you. That's good. Now I wanted to speak to you both because you're physiotherapists here. But Andrew, I'll start with you. What does a physiotherapist do?
So physiotherapists are health professionals that treat across three domains: the musculoskeletal system, so the muscles, bones, joints and associated structures. So things like a sporting injury to the shoulder, the knee, could be a workplace injury to the neck or back. We also work across the neurological system, so the brain and spinal cord. So that may be a disease process such as general ageing, where we're helping people that have had transient ischemic attacks, so things that affect the brain as we get older. And we also deal with people in the cardiovascular domain, so people that may have problems with their heart and lungs. So it could be someone that's had pneumonia and we're looking to clear their chest and make them feel better.
Okay, and so if I were to make an appointment and come in to see you, what would I be expecting from my first appointment?
Yeah, so here at Vineyard we do one-on-one consults, very similar to the doctors. And when people come in, they would generally expect to be answering a series of questions about what they're presenting for, what their expectations are. Generally, if they haven't been to a physiotherapist before, we'll give them an explanation like I did before about what we do. That is then followed, it's a detailed history, mechanism of injury, you know, why they've presented, or it may be a referral from a GP, which it commonly is here, or a specialist. And then what we will do is generally assess the person. So that assessment may entail a physical assessment, getting them to move the injured part, or it may be something that we've been guided by a surgeon or the doctor, which is directing what we're looking for.
Right, okay.
Following the assessment, we will then generally construct some type of treatment plan. Now that treatment may be physical, which physiotherapy is all about, and that could be in the form of manual therapy, it could be mobilisation of a joint, it could be massage, or it could then filter off into the exercise type modalities which physiotherapists are highly trained in. And that could be a strength and conditioning program, range of movement, and it could be just a general management plan to keep people healthy and well.
Right, okay. And so Christine, tell me a little bit about yourself and your physiotherapy's area of interest.
Okay, so my journey has been that I grew up in Sunbury, like Andrew, so we're very passionate about our community. Graduated from Melbourne Uni with a physiotherapy degree and started my first job here at the Physio and Feldenkrais Centre, which no longer exists, but have always been interested in musculoskeletal conditions, and that's branched out into occupational health, so helping the industrial athlete as well out in industrial settings or corporate health settings, so workstation setups. So I bring those skills here to Vineyard Medical Centre, but more recently have branched out into interests that are close to my heart, like Pilates, yoga, therapeutic movement, stretching. So really bringing that mind-body connection, bringing in women's health and a few modalities that really look at the person from a holistic point of view. So.
Okay, and there have been quite a few reforms in regards to Pilates with private health insurance and things like that. What's available these days?
So as of the 1st of April, the private health insurance companies won't cover Pilates or yoga and some of the other natural therapies within the community. But where that is good news for physiotherapy is that physiotherapy has always and always will be physiotherapy. So as Andrew has explained, when a patient comes in, we actually do an assessment. Depending on what their needs are with their injury and condition, we actually prescribe and treat. Now, when we utilise exercise, whether it's physiotherapy straight from some of the literature, whether it's actually Pilates based or yoga based, what we're looking at is the needs of the client and blending that with the aims that we're trying to achieve. So one unique difference is now we're not allowed to use the word Pilates anymore, but physiotherapy, as I said, is physiotherapy. So what we bring is a unique difference to those clinical settings where we're using the exercise to actually treat the individual, and there may be Pilates inspired or informed exercises within that repertoire to meet the aims that we're looking looking for in that person's rehabilitation program.
Okay, so you can really help people across a broad range of issues, and you can be using some of the more, I guess, enjoyed parts of the exercise as well, rather than it having to feel so regimented.
Yes.
And so if people were wanting to make an appointment to come and see either of you, how do they go about that?
Well, as first contact practitioners, people can just ring the clinic and speak to one of the receptionists, and they can make an appointment to see us directly.
Perfect.
They don't have to see the doctor first or the specialist first. Physios are first contact practitioners, so people should feel comfortable just to ring up and make an appointment.
Perfect. Well, thank you so much for your time, Andrew and Christine. I really appreciate it.
Thank you.
Thank you.